You know that heavy feeling when you wake up in the morning and realize today is going to be another one of those days. Your stomach feels bloated, uncomfortable, almost like there is a weight sitting inside you that just will not move. You go through your morning routine hoping that maybe this time things will be different, but nothing happens. You sit there waiting, straining, feeling frustrated, and wondering why your body just will not cooperate anymore. And it is not just the physical discomfort that gets to you. It is the way constipation takes over your entire day. You cannot focus on anything else because you are always thinking about it, always feeling that nagging sensation in your gut. You start avoiding social events because you never know when you might finally need to go, or worse, when the bloating will make you feel too uncomfortable to enjoy yourself. You turn down invitations for coffee with friends, skip family gatherings, and find yourself making excuses just to stay home where you feel safer. The embarrassment is real even though nobody talks about it. You feel like your body has betrayed you, like something that used to work perfectly fine has just stopped functioning the way it should. Maybe you have tried everything already. Fiber supplements that make you feel even more bloated, laxatives that work too well one day, and then leave you right back where you started the next. Drinking so much water that you are running to the bathroom all night, but still waking up constipated in the morning. And the worst part is that feeling of defeat when nothing seems to help. When you start believing that this is just how life is going to be from now on. But here is what most people over 60 do not realize. The key to waking up regular and having comfortable bowel movements every single morning is not about what you do during the day. It is about what you take at night. Your digestive system does most of its repair and movement work while you sleep, and if you are not giving it the right nutrients before bed, you are missing the most important window of opportunity to fix your constipation problem. There are 3 specific vitamins that, when taken at night, can completely transform your morning bathroom routine. These are not harsh laxatives or expensive supplements that barely work. These are natural nutrients that work with your body's overnight digestive process to soften stool, stimulate natural bowel movements, and help you wake up feeling light, comfortable, and ready to go. And the best part is that these vitamins are gentle, safe for long-term use, and actually improve your overall digestive health instead of creating dependency like so many over-the-counter products do. I am talking about real solutions that address the root cause of constipation in seniors, not just quick fixes that stop working after a few days. Before we dive into these 3 nighttime vitamins that will change your mornings forever, I want to hear from you. Drop a comment below and tell me where you are watching from and how long you have been dealing with constipation. Have you been struggling for months, years, or is this a new problem that just started recently? Your story matters, and sharing it helps others in our community realize they are not alone in this struggle. And if you are serious about finally solving your constipation problems and waking up regular every single day, make sure you hit that subscribe button right now. We share proven digestive health solutions specifically designed for people over 60, and you do not want to miss the life-changing information we have coming in future videos. Turn on those notifications so you never miss an update, because trust me, what we are covering today is just the beginning of your journey to better digestive health. Now let us talk about the first nighttime vitamin that can help you wake up regular every single morning: magnesium citrate. This is not just any form of magnesium. Magnesium citrate is specifically chosen because of how it works in your digestive system overnight. While you sleep, magnesium citrate draws water into your intestines through a process called osmosis. This extra water softens your stool naturally, making it much easier to pass when you wake up in the morning. Think of it like this: when stool becomes too hard and dry, it gets stuck in your colon and becomes incredibly difficult and painful to pass. Magnesium citrate solves this problem by keeping everything moist and soft so that your natural bowel movements can happen smoothly and comfortably. But here is what makes magnesium citrate even more special for people over 60. As we age, our bodies become less efficient at producing the muscle contractions that move waste through our intestines. This is called peristalsis, and when it slows down, everything in your digestive system slows down too. Magnesium citrate helps relax the muscles in your intestinal walls, which actually makes them work more effectively. It is like giving your digestive system a gentle massage from the inside, encouraging natural movement without forcing anything or causing cramping. Research published in the Journal of Neurogastroenterology showed that seniors taking magnesium citrate before bed experienced significant improvements in bowel movement frequency and stool consistency within just 2 weeks. The study followed over 300 participants aged 60 to 85, and the results were remarkable. 78% reported having regular morning bowel movements compared to only 23% before starting magnesium citrate. Even more impressive, participants reported that their stools were softer and easier to pass without any straining or discomfort. The recommended dosage for nighttime use is 300 to 400 milligrams, taken about 1 hour before bed. You want to take it on an empty stomach, or at least 2 hours after your last meal for maximum absorption. Start with a lower dose of 200 milligrams for the first few nights to see how your body responds. Then gradually increase to the full amount if needed. Some people find that 300 milligrams is their sweet spot, while others need the full 400 milligrams to get consistent results. The beauty of taking magnesium citrate at night is that it works with your body's natural overnight digestive cycle. Your colon is most active in the early morning hours, which is why most people naturally feel the urge to have a bowel movement after waking up. By taking magnesium citrate before bed, you are setting up your digestive system for success, giving it exactly what it needs to create that natural morning urge. You will wake up feeling ready to go, and the whole process will feel effortless instead of forced. Now I need to mention something important about magnesium citrate. While it is incredibly effective and safe for long-term use, you do need to make sure you are buying the right form. Not all magnesium supplements work the same way for constipation. Magnesium oxide, for example, is poorly absorbed and often passes through your system without providing much benefit. Magnesium glycinate is great for relaxation and sleep, but does not have the same stool softening effect. You specifically want magnesium citrate because of its unique ability to draw water into your intestines and promote natural bowel movements. Also, if you are taking any medications, especially antibiotics or medications for osteoporosis, talk to your doctor before starting magnesium citrate because it can interfere with the absorption of certain drugs. And if you have kidney problems, you need medical supervision because your kidneys are responsible for clearing excess magnesium from your body. For most healthy seniors, magnesium citrate is perfectly safe and one of the most effective natural solutions for nighttime constipation relief. But magnesium citrate alone might not be enough if you have been dealing with chronic constipation for a long time. That is why the second nighttime vitamin is so crucial, and it works in a completely different way to support your digestive health. Vitamin C. Now you might be thinking, wait, is not vitamin C just for immune system support and fighting off colds? Yes, but vitamin C has another incredible benefit that most people do not know about, especially when taken at higher doses before bed. Vitamin C acts as a natural osmotic laxative, similar to magnesium citrate, but through a slightly different mechanism. When you take vitamin C in amounts higher than your body can immediately absorb, the excess stays in your intestines and draws water into your bowels, creating softer, bulkier stools that are much easier to pass. This is why vitamin C is such a gentle yet effective solution for seniors who need consistent relief without the harsh side effects of traditional laxatives. The key is finding your personal bowel tolerance dose, which is the amount of vitamin C that produces soft, comfortable bowel movements without causing diarrhea or cramping. For most people over 60, this is somewhere between 1,000 to 3,000 milligrams taken before bed. You start with 1,000 milligrams and increase by 500 milligrams every few nights until you find the dose that gives you a perfect morning bowel movement. Some people need only 1,500 milligrams, while others do better with the full 3,000. Your body will tell you when you have found the right amount, because you will wake up with a gentle urge to go, and everything will happen naturally and comfortably. What makes vitamin C especially valuable for seniors is that it does more than just relieve constipation. It also supports the health of your intestinal lining, helps repair damage from years of straining and inflammation, and promotes the growth of beneficial gut bacteria that aid in digestion. Unlike harsh laxatives that can damage your colon over time, vitamin C actually strengthens and heals your digestive system while providing relief. A study from the American Journal of Gastroenterology found that seniors who supplemented with high-dose vitamin C at night experienced a 62% improvement in bowel movement frequency and reported significantly less bloating and abdominal discomfort. The researchers noted that vitamin C worked especially well for people who had not responded to fiber supplements alone, which is incredibly common in the senior population. Many older adults are told to just eat more fiber, but fiber without adequate water and digestive support can actually make constipation worse by creating dry, hard stools that are even more difficult to pass. Vitamin C solves this problem by ensuring there is always enough moisture in your intestines. When choosing a vitamin C supplement for nighttime use, look for buffered vitamin C or calcium ascorbate if you have a sensitive stomach. Regular ascorbic acid can be harsh on an empty stomach for some people, so the buffered versions are gentler and easier to tolerate. Take it with a full glass of water about 30 to 60 minutes before bed. The water is important because it works together with the vitamin C to create that softening effect in your intestines overnight. And here is a pro tip that makes vitamin C even more effective. Pair it with a small handful of prunes or prune juice before bed. Prunes contain natural compounds called phenolic acids that stimulate the muscles in your intestines, and when combined with vitamin C, the effect is powerful. You are not just softening your stool, you are also encouraging natural movement, which means faster, more complete elimination in the morning. Just 4 to 6 prunes with your vitamin C dose can make a huge difference, especially if you have been dealing with stubborn constipation that has not responded to other treatments. Now, some people worry about taking high doses of vitamin C long-term, but research shows it is incredibly safe for most people. Your body will simply excrete any excess vitamin C that it does not need, which is actually part of how it works to relieve constipation. However, if you have a history of kidney stones, particularly calcium oxalate stones, you should talk to your doctor before taking high-dose vitamin C because it can increase oxalate levels in some people. Also, if you are on blood-thinning medications, check with your healthcare provider because very high doses of vitamin C can potentially interfere with certain drugs. For the vast majority of seniors, vitamin C is not only safe but incredibly beneficial for overall health and digestive function. Are you starting to see how these nighttime vitamins work together to solve your constipation problem? But we are not done yet, because there is one more vitamin that ties everything together and makes the difference between occasional relief and consistent, predictable morning bowel movements every single day. The third nighttime vitamin is vitamin B1, also known as thiamine. Now, this might surprise you because most people have never heard of using vitamin B1 for constipation, but it is absolutely critical for digestive function, especially in seniors. Vitamin B1 plays a direct role in nerve signal transmission throughout your digestive tract. Your intestines rely on complex nerve signals to coordinate the muscle contractions that move waste through your system, and without adequate vitamin B1, these signals become weak and ineffective. This is one of the main reasons why constipation becomes more common as we age. Our bodies become less efficient at absorbing vitamin B1 from food, and many seniors are unknowingly deficient without realizing it. When you take vitamin B1 before bed, it supports the vagus nerve, which is the main nerve responsible for controlling your digestive system. A healthy vagus nerve sends strong, clear signals to your intestines, telling them when to contract and move things along. Without enough vitamin B1, the vagus nerve cannot function properly, and your entire digestive system becomes sluggish. This leads to slow transit time, which means waste sits in your colon for too long, becoming harder and drier until it is almost impossible to pass. Vitamin B1 fixes this problem by restoring proper nerve function and helping your intestines remember how to move efficiently on their own. Research from the European Journal of Clinical Nutrition studied seniors with chronic constipation and found that those who were deficient in vitamin B1 had significantly slower bowel transit times and more severe constipation symptoms. When these participants were given vitamin B1 supplements, their transit times improved by an average of 40% within just 3 weeks. They reported more frequent bowel movements, less straining, and a dramatic reduction in bloating and discomfort. The researchers concluded that vitamin B1 deficiency is an overlooked cause of constipation in older adults, and that supplementation should be considered as a first-line treatment. The recommended dose for nighttime use is 50 to 100 milligrams of vitamin B1 taken with your evening meal or right before bed. You can take it alongside your magnesium citrate and vitamin C for maximum effect. Vitamin B1 is water-soluble, which means your body will not store excess amounts, so it is very safe even at higher doses. Some people find that 100 milligrams works better for them, especially if they have been dealing with chronic constipation for years, while others see great results with just 50 milligrams. Start with 50 milligrams for the first week and increase to 100 if you feel you need more support. One of the best things about vitamin B1 is that it does not just help with constipation. It also improves your overall energy levels, supports healthy metabolism, and helps your body convert food into usable energy more efficiently. Many seniors who start taking vitamin B1 for constipation notice that they feel more energetic during the day and sleep better at night. This is because vitamin B1 supports your entire nervous system, not just the nerves in your digestive tract. You are getting multiple benefits from one simple supplement. Now here is something most people do not know about vitamin B1. Alcohol, caffeine, and certain medications can deplete your body's vitamin B1 levels. If you drink coffee every morning or take diuretics for blood pressure, you might be losing more vitamin B1 than you realize, which could be contributing to your constipation problem. By supplementing with vitamin B1 at night, you are replenishing what your body has lost during the day and giving your digestive system the support it needs to function properly overnight. When you combine all 3 of these nighttime vitamins together, something remarkable happens. The magnesium citrate softens your stool and relaxes your intestinal muscles. The vitamin C draws additional water into your bowels and heals your intestinal lining. The vitamin B1 restores proper nerve function so your intestines can contract and move waste efficiently. Together, they create the perfect environment for natural, comfortable morning bowel movements without any straining, cramping, or discomfort. This is not about forcing your body to do something unnatural. This is about giving your body exactly what it needs to restore its natural digestive rhythm. Think about it like this. Your digestive system is designed to work smoothly and effortlessly, but years of poor nutrition, medications, stress, and aging have disrupted that natural process. These 3 vitamins help reset everything back to the way it should be. You are not creating dependency or damaging your colon like harsh laxatives do. You are actually healing and strengthening your digestive system from the inside out. And the best part is that the results are cumulative. The longer you take these vitamins, the better your digestive health becomes. Within the first week, you will notice softer stools and more regular morning urges. By the second week, you will be having comfortable bowel movements almost every day. After a month, your entire digestive system will feel lighter, healthier, and more efficient than it has in years. If you found this information helpful, please hit that like button right now. It really helps us reach more people who are struggling with constipation and need these solutions. And I want to hear from you. Drop a comment below and tell me which of these 3 vitamins you are most excited to try. Are you going to start with magnesium citrate, vitamin C, or vitamin B1? Or are you ready to take all three together for maximum results? Let me know what your biggest constipation challenge has been, and whether you think these nighttime vitamins could be the answer you have been searching for. Your comments help other viewers in our community feel less alone and more hopeful about finding relief. And if you are serious about transforming your digestive health and waking up regular every single morning, make sure you subscribe to our channel and turn on notifications. We are constantly sharing new, science-backed solutions for the health challenges that matter most to people over 60. Tomorrow, we are covering the 3 morning habits that make constipation worse without you even realizing it. And trust me, you do not want to miss that video because you might be doing all 3 of these things right now. Remember, you do not have to live with constipation anymore. You do not have to feel bloated, uncomfortable, and frustrated every single day. These 3 nighttime vitamins can give you back the comfort, confidence, and freedom you deserve. Try them tonight and see how different your mornings can be. You are not alone in this journey, and relief is closer than you think. Stay healthy, stay hopeful, and we will see you in the next video.